I think a great practice model is where the bread and butter of your practice is everyday general dentistry, the bread and butter. And in addition to the everyday bread and butter, you include some high value services that you really enjoy doing as well in your practice. Not necessarily all of them, but there may be some high value. You may enjoy doing cosmetic dentistry. You may enjoy doing more adult orthodontics. Another thing you may enjoy is placing and restoring implants. Maybe those are your 3 high value services. So, and again, I'm making those up randomly based on where I see dentists that have some interest. But I think the foundation of everyday general dentistry is a great foundation that makes your practice, I'm gonna say it, dare I say, recession proof? Well, I'm going to say it. Makes your practice recession proof, because everyday general dentistry is going to be services that are needed all the time.
Right.
You know, it's not dependent on a good economy to have a thriving practice.
And when you say everyday general dental practice, you're talking about one that's anchored or built around a strong hygiene practice, correct?
It would be a strong hygiene department. It would be doing things like, like fillings, like crowns, the things we see every day. Maybe limited oral surgery. Maybe you enjoy doing simple extractions. Maybe you do a certain endo in your practice. Maybe you enjoy doing, say, anterior bicuspid first molar. As long as it looks like you could do that root canal in an hour or less, that might be a good way to decide, to incorporate endodontics in your practice. If you practice in an urban area or in a suburban area, there's probably great specialists nearby that you can refer to for things that are outside of your scope.
Right.
And, I don't think you have to keep everything in-house. I don't think that's necessarily wise. Now, if you're practicing in a very remote area, you may have to broaden your scope. You may want to broaden your scope because of the fact that a patient might have to drive hours and hours and hours to go to an orthodontist. Maybe the nearest orthodontist is 3 hours away. And orthodontic treatment isn't one and done. It's a whole series of appointments. You may choose to incorporate ortho because you want to serve your patient's orthodontic needs, and they're not being served in your community. But I think what I just described is a pretty unusual situation, today,
right,
where population centers are today. If you're interested in rounding out your general dental experience, I would strongly encourage you to get involved with the AGD, the Academy of General Dentistry, and work on your fellowship, earn a fellowship, and perhaps even later earn a mastership. And that requires you to take a massive amount of CE and 7 different sub-disciplines within dentistry that will make you a very well-rounded general dentist. And again, you don't have to do everything, but you're going to be very well-rounded. And then when it comes to the high-value services, pick the things that you like to do. That you really, if the idea of thinking about going to a CE course on cosmetic dentistry gets you excited about the coming trip for CE, then that's something that you ought to do more of. By the way, I'm going to come back to the General Dental Practice Foundation. One of the really cool things about the General Dental Practice Foundation, besides it being recession-proof, that's a pretty cool thing, wouldn't you say?
Absolutely. I think as we are moving into a pretty uncertain times in some sense because of the economy, the inflation, interest rate, all these forces. And of course, now we have wars going on the sidelines, which we haven't had in a long time. So I agree. I think recession is, and how to have a safe practice is probably in everybody's mind.
Well, I mean, let's face it, we've got some possible headwinds, economic headwinds. Right. I hope we can avoid those, but we've got some possible economic headwinds. And I believe a General Dental Foundation will serve you well if those headwinds, come to fruition. But one of the other cool things about having a General Dentist Practice Foundation is that you can cultivate your high-value services among your general dental patients. So you can plant seeds, perhaps cosmetic dentistry. Maybe your patient is interested in improving their smile, but they're not ready to do that yet. And you can cultivate those seeds, and very often those high value services can come from your existing patient base who realizes you also do those things. And as a result of that, you can, in essence, plant a lot of seeds and cultivate those and do a whole lot of high value services, once you've earned the trust of your patients. So that's another great byproduct of having a general dental foundation, is it lays the groundwork to doing a lot of high value services on patients who already know, like, and trust you.